One of the exciting news at this year's ASH, or this year, is the approval of, at least in the United States, for obe-cel, a newer kind of CD19 targeted CAR T cells for our adult patients with the relapsed refractory B-cell ALL. And one of the things that we were able to look at in the context of the FELIX study that led to FDA approval is the use of bridging therapy. We do know that the patients who receive obe-cel and other CAR T cells, CD19 targeted CAR T cells, at the time of low disease burden tend to do better in terms of longer remission duration and event-free survival and overall survival. So we wanted to look at the role of inotuzumab, CD22 targeted immunotherapy, to see how effective it is reducing the disease burden and allowing these patients to hopefully have a better outcome after CAR T cell therapy. And the second is that there are some concerns with the inotuzumab previously that it might be too effective in getting rid of all the B cells that you may need for CD19 CAR T cells to engage and to allow T cell expansion. So we also wanted to look at the impact of inobridging on CAR T cell expansion as well. And this study, this abstract that we presented, showed that inotuzumab was very effective, whether used alone or in combination with a minimal chemotherapy, in reducing disease burden, very high disease burden to 80 to 90% bone marrow blast. We're getting down to less than 5%, usually with less than one cycle of inotuzumab. Usually one or two doses is highly effective in this setting. And we were able to demonstrate that CAR T cells expand greatly in those patients as well. They did expand less than those patients with higher disease burden. That part is expected because they had a less disease, and we do see that whether it's INO or not related, the lower disease burden patients tend to have a lower peak, and then the slightly lower AUC, which was observed in this study as well. But it was encouraging to see the CAR T cells expanded, and these patients did have a better outcome compared to patients who received CAR T cell at higher disease burden with ineffective bridging, which was mostly due to chemotherapy.